This is 7-year-old Colin. While he's like many boys his age, he is unique in terms of the way his brain processes information, his behaviors and interactions with others, his sensory processing and motor movements, and his mental and medical health complexity. Colin has autism, which is a spectrum that includes those who are extremely gifted to those who are severely disabled. In fact, over the last 10 years, the prevalence of autism in Ontario has increased by over 120% to include over 40,000 children with increasing complexity. The goals that Colin and his parents Leah and Alwyn hold for him are no different than the goals we hold for ourselves or our own children: to maximize his potential, to increase access to the right supports at the right time, to transition effectively between systems like home, school, university, and employment, and to be independent, integrated, and experience true citizenship in his community. We cannot ignore that the support systems around Colin are also in need. Parents and caregivers that face enormous stress and exhaustion. Support professionals that need more training and connection to Colin. And government and policymakers who struggle to get useful information to adjust the system for Colin's success. Surrey Place Centre is in a unique position to address these needs. For over 30 years, SPC has been providing specialized clinical services for developmental disabilities and autism in the Toronto region. Our interprofessional supports include over 16 professions like doctors, nurses, behavior therapists, and speech and language pathologists who provide supports that include assessment, diagnosis, counseling, and treatment to individuals, families, caregivers, and other community agencies. SPC is also the government-appointed single point of access and lead agency for all children's autism services in Toronto. A number of research studies suggest that this is the ideal time for SPC to innovate in the children's autism environment, with the alarming autism prevalence rates, emerging generational demands for services and funding to be reshaped to meet changing needs, technological advancements, and the availability of data that enables greater collaboration and prototyping of new solutions to persistent social challenges, and a nonprofit sector that is demanding what works centers or evidence-based approaches that gather and supply important data to refine important systems like autism. SPC plans to focus on 3 target customer segments: families and caregivers who need access to real-time information to plan and make informed decisions with multiple support providers, professional support personnel who need better ways to access and contribute to shared plans of care than current manual paper-based systems that inhibit efficacy, communication, and collaboration. And finally, the Ontario Ministry of Children and Youth Services that runs the children's autism system that needs better information to effectively monitor and evolve the system. We will launch a modern, integrated, online user experience designed electronic health records and plan of care system that will connect our internal records with family caregiver and individual integrated portals that provide families with real-time information. Community partner integrated portals that enable seamless collaboration and communication from multiple support professionals. Within these portals, we will develop integrated, technology-enhanced tools that support effective monitoring, decision-making, and independence. The overall system will generate and house important data, research, and evaluation to continuously improve overall autism services in the Toronto region. We will enter the market firstly through the direct channel of our internal direct service clients of approximately 15,000 per annum. We will subsequently access a larger client base through the indirect channels of over 30 community partner agencies that support over 120,000 clients per year. In 5 years, by 2022, our goal is to capture 52% of this market, or 65,000 clients per year. From a pricing perspective, our solution is more expensive than current ineffective manual systems that permeate the autism system. It is, however, cost competitive, as we will build our solution on the award-winning Microsoft CRM system that provides deep discounts to the nonprofit sector and is significantly cheaper than complex, competing for-profit and highly customized boutique solutions. We will bundle both the solution and technical help desk support to community agencies and fund our solution primarily through government funding and technology grants that are in search of these types of innovations. Our annual budget in 2018 is $485,000, or just $58 per client, and will build to $546,000, or $8 per client, by 2022, as the solution expands across Toronto. Our approach to customer acquisition and retention is to focus on modern user experience design approaches that will help us co-create the solution in meaningful and personally relevant ways with our target customer segments. We will develop the solution through an agile process with usability testing to target real-life pressure points. Finally, we will focus on continuous improvement through structured feedback and engagement of our users around their priority requirements, functions, data, research, and evaluation needs. Our marketing strategy includes 4 key elements: a laser focus on family and support personnel needs, speaking directly to their priorities; maintaining a modern and scalable approach with Microsoft solutions that can be easily configured and integrated into multiple service settings; proving value for money by leveraging Microsoft discounts, broad support networks for Microsoft solutions, and their integration into everyday tools like Microsoft Office; and finally, showing evidence of continuous improvement through ongoing engagement and feedback with our target users. We will execute our marketing strategy by accelerating solution adoption and utilization across core clinical services in the Toronto region. We will share powerful client and system impact stories through the web, videos, sector events, and funder updates. And we will plan for approximately $75,000 per annum in marketing and communications. Detailed supporting schedules for this presentation are available at request that include 15 research reports, 18 expert interviews, a business model canvas, a 5-year budget, and examples of modern user experience design tools that will engage our target users. In closing, this is the ideal time for SBC to innovate in the Toronto Children's Autism System. Research, stakeholder feedback, and SBC's commitment to individuals with autism confirms that we have a unique solution for Colin, his support team, and other children like him.